Welcome to the Nutrition Support and Modified Diet Training module for Wall Residences. My name is Jessa Lane, the Medical Quality Assurance Coordinator, and I will be guiding you through this training module. The purpose of this module is to maintain compliance with licensing regulations, to review the purpose of modified diets as well as the types of modified diets, to understand the difference between liquid consistencies for beverages, understand documentation requirements, as well as to review some potential complications for individuals that are at risk. Purpose of modified diets. Most individuals with developmental disabilities can eat all foods and textures. However, some individuals need a modified diet for health and safety reasons. If an individual has difficulty swallowing food safely, it can increase the likelihood of complications such as choking and aspiration. A modified diet must be ordered by a healthcare professional and can include food restrictions and consistency requirements. Oftentimes, a physician will recommend an individual be evaluated by a speech pathologist in order to make final diet recommendations. It is extremely important for service providers to adhere to the restrictions and the recommendations made by healthcare professionals regarding nutritional intake and modified diets. There are certain neurological and medical conditions that may warrant an individual requiring a modified diet. A few examples are on the screen in front of you. Please take a moment to review. Types of modified diets. The type of modified diet prescribed will depend on an individual's ability to safely swallow. The most common types of modified diets are regular consistency, chopped textured, mechanical soft, and pureed. Modified liquid consistency. Food texture is not the only modification that can be made to diets. Liquid beverages can be modified to ensure safe swallowing as well. The most common types of modified liquid beverages are regular consistency, honey thick, nectar thick, and pudding thick consistency. For further explanation, I have included a video from a training that I received from Central Virginia Training Center. This video includes in-depth information about the types of modified diets as well as the types of liquid consistency modifications.
Many individuals with intellectual disability also have medical problems and physiological issues which require them to have a modified texture diet. The ability to eat safely cannot be taken for granted. The food may not be in the mouth after the person swallows it, but it's what you can't see when the food is going through the throat that can cause the person harm. The texture of the individual's food and beverages can make a difference between safe eating, illness, and even death. This video will show you how diet textures have been standardized nationwide by the National Dysphagia Diet Task Force. We will talk about the differences in the diet textures and show you how you can prepare meals to accommodate varying diet textures. Let's start with the texture that requires the most alteration in texture. The pureed texture consists of pureed cohesive foods. The texture should be uniform or the same throughout the entire portion. Food should be pudding-like with no coarse texture, raw fruits or vegetables or nuts. Any foods that require manipulation of the food in the mouth to make it cohesive and soft before swallowing would be excluded. This diet texture is designed for people who have moderate to severe swallowing problems with poor manipulation of food in the mouth and reduced ability to protect their airway. Very close supervision is usually required. All meats must be pureed, although soufflés that are smooth and homogeneous are allowed. Avoid cheese, cottage cheese, peanut butter, and non-pureed fried, scrambled, or hard-cooked eggs. Pureed vegetables without chunks, lumps, pulp, or seeds are allowed. Tomato paste or sauce without seeds is appropriate for this diet texture. Mashed potatoes or sauce, pureed potatoes with gravy, margarine, or sour cream are also allowed with this diet texture. Well-cooked pasta or noodles that have been pureed to a smooth, homogeneous consistency are allowed. Pureed fruits or fruit juices are appropriate for the pureed diet consistency. Cooked or canned fruit is the easiest to puree. Whole fruits are not permitted. Bread products must be prepared from pureed bread mixes, or a slurry mixture can be poured over the entire bread to make it smooth, homogeneous, and easy to swallow without any chewing or manipulation in the mouth. The slurry mixture recipe is in your handout. All other bread products are not allowed. Smooth, homogeneous cooked cereals, such as farina-type cereals, are allowed. All cereals should have a pudding-like consistency. Oatmeal and any other dry or cooked cereal with lumps, seeds, or chunks are not permitted. Desserts for individuals on a pureed diet texture include smooth puddings, custards, yogurt, pureed desserts, and soufflés. Ices, gelatins, frozen juice bars, cookies, cakes, pies, pastry, coarse or textured puddings, bread and rice pudding, and fruited yogurt are not allowed. A few individuals need to have an even finer pureed texture due to their swallowing impairment. This is a super strained pureed texture similar to stage 1 and stage 2 baby foods. Some names given to this texture are advanced pureed, baby food, or strained puree. For individuals who require this type of diet, it is best to use the jars of stage 1 or stage 2 baby food in order to obtain the appropriate texture if you are not skilled in preparing this type of food. This pureed texture is thinner than regular puree. The mechanical soft texture includes foods that are moist and soft textured with some cohesiveness so that they can easily be formed into a soft, rounded mass in the mouth before swallowing. This diet is a transition from the pureed texture to more solid textures. Some chewing ability is required. People on this diet should be evaluated for tolerance of mixed textures such as soups and stews. Meats that are appropriate for people who require this texture include moistened ground or cooked meat, poultry, or fish. Moist ground or tender meat may be served with gravy or sauce. Macaroni and cheese, pasta with meat sauce, soft moist lasagna, and casseroles without rice are allowed. Moist meatballs and meatloaf, as well as protein salads such as tuna or egg without large chunks, celery or onion, are allowed. All meats or protein substitutes should be served with sauces or moistened to help maintain cohesiveness in the mouth. Avoid dry meats, tough meats such as bacon, sausage, and hot dogs. Also, dry casseroles or casseroles with rice or large chunks, cheese slices and cubes, peanut butter, hard-cooked eggs, sandwiches, or pizza should be avoided. All soft, well-cooked vegetables are allowed. Vegetables should be less than 1/2 inch in size and should be easily mashed with a fork. Avoid cooked corn and peas, as well as broccoli, cabbage, Brussels sprouts, asparagus, or other fibrous, non-tender, or rubbery cooked vegetables. Well-cooked, moistened, boiled, baked, or mashed potatoes are allowed. Avoid potato skins, chips, and French fried potatoes. Rice is not allowed with this texture. Soft, drained, canned, or cooked fruits without seeds or skin are allowed. A soft banana that can easily be mashed is allowed. Avoid other fresh fruits and all frozen fruits. Soft pancakes, well moistened with syrup or sauce, are allowed. Bread that has a slurry poured over it so that it literally melts in the mouth is allowed, but avoid all other breads unless the individual has been evaluated and allowed other types of bread. Cooked cereals with little texture, including oatmeal, are allowed. Slightly moistened dry cereals with little texture, such as Corn Flakes, Rice Krispies, or Wheaties, are allowed. Avoid any cereal with nuts, seeds, dried fruit, and or coconut, as well as whole grain, dry, or coarse cereals. The best desserts for people on a mechanical diet texture are pudding, custard, soft fruit pies with a bottom crust only, crisps and cobblers without seeds or nuts, and with soft breading or crumb mixture. They may also eat soft, moist cakes with icing or soft, moist cookies that have been dunked in milk, coffee, or some other liquid. Avoid dry, coarse cakes and cookies, anything with nuts, seeds, coconut, pineapple, or dried fruit, as well as rice or bread pudding. The chopped texture, which is sometimes called the dysphagia advanced texture, includes foods of nearly regular textures with the exception of very hard, sticky, or crunchy foods. All foods need to be moist and should be in bite-sized pieces when eaten. Adequate dentition and chewing are also required for this diet. People on this diet should be evaluated for tolerance of mixed textures such as soups, stews, and cold cereal with milk. It is expected that mixed textures are tolerated on this diet. Meats served include thin sliced, tender or ground meats and poultry, well-moistened fish, eggs, yogurt without nuts or coconut, and casseroles with small chunks of meat, ground meats or tender meats. Avoid tough dry meats, fish with bones, and chunky peanut butter. Meats should be served in bite-sized pieces. All cooked, tender vegetables and fresh lettuce are allowed, but other raw vegetables should be avoided. Also avoid cooked corn and non-tender or rubbery cooked vegetables. Rice, moist bread dressing, and tender fried or mashed potatoes are allowed. Avoid tough, crisp fried potatoes, potato skins, and dry bread dressing. All canned and cooked fruits, as well as soft, peeled, fresh fruits such as peaches, cantaloupe, and watermelon are allowed, as long as the seeds are removed. Avoid difficult-to-chew fresh fruits such as apples or pears. Soft berries with small seeds, such as strawberries, are allowed, but avoid stringy, high-pulp fruits such as papaya, pineapple, or mango. Also avoid fresh fruits with difficult-to-chew peels such as grapes, uncooked dried fruits such as prunes and apricots, and fruit roll-ups, fruit snacks, and other dried fruit. Any well-moistened breads, biscuits, muffins, pancakes, and waffles are recommended. Make sure you add enough syrup, jelly, or margarine to moisten well. Avoid dry breads, toast, or tough, crusty breads. All well-moistened cereals are allowed, but coarse or dry cereals such as shredded wheat should be avoided. Individuals on the chopped diet texture can have most desserts, but avoid dry cakes, cookies that are chewy or very dry, and anything with nuts, seeds, dry fruits, coconut, or pineapple in it. The regular texture is what most people eat on a daily basis. This diet requires adequate dentition and good chewing skills. Meats may need to be cut up before eating, and they need to be chewed very well. Fresh and canned fruits and vegetables are appropriate. Salads, soups, cold cereals with milk, and other foods that contain a variety of consistencies in the same dish are appropriate. Cake-like desserts can contain nuts or fruit pieces. Breads with crusts, toast, and crackers are appropriate. Some individuals may not be able to drink thin liquids due to swallowing problems and the risk of aspirating the liquid into the lungs. Nevertheless, the body must have enough liquid to prevent dehydration. Liquids may be thickened by commercial thickening agents, but this should not be attempted without an evaluation and recommendation for thickened liquids by a speech-language pathologist. Thickened liquids are generally classified into 3 types: nectar-like, honey-like, and pudding-like, which is sometimes called spoon-thick. Pre-thickened liquids are available for nectar-like and honey-like liquids. Commercial thickeners are available in individual packets and in canisters. Not all thickeners work in the same way, and not all thickener recipes are the same. Now we will show you how some foods served in a home could be pureed. Foods that need to be pureed are often the most difficult to process to the smooth, pudding-like texture needed by individuals who have no ability to chew and may have other oral motor problems which require this texture. We are going to show you what the regular food looks like and the pureed version of the same food. Here you see a chicken pot pie, regular and pureed. We are now going to show you how to actually puree some lasagna. Here we have the regular lasagna, and now we will puree some lasagna. You may need to add additional liquid. In this case, tomato sauce is being added. Make sure you check the food after processing for 60 to 90 seconds. Scrape the sides and check to see that the food is smooth with no lumps. You may need to process it a little bit longer. It's a much smoother consistency now. If you're not sure that the food is pureed smooth enough, it probably means that you still have work to do to get the food to the right consistency before it can be served. Providing the appropriate food texture is important for all of the individuals you serve. We have provided a handout that goes with this short video which describes the diet textures you have seen here today and also gives some recipes. This has been a short introduction to the food textures that you may encounter with individuals you serve. Please be aware, some individuals may be able to tolerate minor texture variations in some foods and others may not. Some people may need foods to be thinned down or thickened up a little. The individual training that you receive on the person's eating plan should address these issues. Also, some individuals may not be able to tolerate some foods mentioned in this video because of allergies or medical problems. Always ask questions when you are trained to follow an individual's plan if you are uncertain of any requirements for their diet.
Monitoring individuals for safety during meals and snacks is extremely important to prevent severe and potentially life-threatening complications such as choking and aspiration pneumonia. Choking. Choking occurs when a foreign object is aspirated and becomes lodged in the throat, blocking airway to the lungs. In adults, food is often the culprit. Food that is not chewed properly or eaten too quickly can cause a person to choke. Since choking cuts off oxygen to the brain, utilization of first aid, CPR, and emergency response services is important. The universal sign for choking is hands clutched to the throat. Other signs include the inability to talk, difficulty or noisy breathing, inability to cough, skin turning blue, and a loss of consciousness. Aspiration. Aspiration occurs when a foreign substance such as food, drink, vomit, or saliva is inhaled into the lungs. Aspiration may or may not lead to an infection known as aspiration pneumonia. Aspiration can occur repeatedly in small amounts over time. Signs of aspiration may not be readily detected by caregivers, as individuals may not show the common signs of aspiration that include coughing, gagging, or wet-sounding breathing. Aspiration generally occurs due to a loss of muscle tone and muscle coordination in the mouth and throat. Aspiration is one of the fatal 4 health issues that can cause serious injury or even death for individuals. Aspiration pneumonia. This occurs when a foreign substance such as food, drink, vomit, or saliva is inhaled into the lungs and causes an infection. Individuals who require modified diets or assistance feeding themselves are at a greater risk of developing aspiration pneumonia. Also, individuals who suffer from frequent heartburn or gastroesophageal reflux disease, otherwise known as GERD, are at a high risk of developing aspiration pneumonia. Signs of aspiration pneumonia include chest pain, bluish discoloration of the skin, coughing up foul-smelling or discolored phlegm, fever, fatigue, shortness of breath, and wheezing. If you note any of these signs in an individual, seek medical attention promptly. The next few slides are going to discuss potential risk factors and complications of aspiration. Individuals with developmental disabilities are at an increased risk of aspiration. Some risk factors that would contribute to aspiration include being fed by others or being fed by inadequately trained caregivers, a weak or absent cough and gag reflex, poor chewing and swallowing skills, no teeth or lack of adequate amount of teeth, stuffing food into the mouth or drinking too rapidly, inappropriate food and fluid consistencies or textures, side effects of medications that include drowsiness and relaxed muscles, impaired mobility, impaired ability to change body positions independently, as well as a diagnosis of epileptic seizures. Signs of aspiration include gagging and choking during meals, irregular breathing, intermittent and unexplained fevers, chronic dehydration, unexplained weight loss, and vomiting after meals. Interventions for aspiration include initiating emergency response services if needing, stop feeding an individual immediately if you suspect aspiration, feed individuals in an upright position and encourage coughing if possible, eat or feed more slowly, keep an individual in an upright position for 30 to 45 minutes after meals. If in doubt, contact a healthcare professional for a medical assessment, obtain and request a consult for a speech pathologist for a swallowing study, and follow the steps outlined in the aspiration protocol. An ounce of prevention is worth a pound of cure, especially when we're talking about aspiration. The aspiration protocol should be developed for each individual who requires a modified diet. The aspiration protocol provides detailed information about supports provided to an individual to prevent aspiration. The information to be included in the protocol includes the level of assistance needed during meals and feedings, correct positions for meals and feedings, adaptive equipment and its uses, use of physical and verbal cues during feedings, recognition of aspiration signs, and what to do if aspiration is observed or suspected. Members of an individual's team will work together to develop an aspiration protocol. It is extremely important for providers to take an active role in the development of the protocol, as providers are the expert caregivers who are responsible for ensuring the implementation of the protocol. The protocol will be signed by the physician annually or more frequently as update or changes are needed. For more information about protocols and tips on how to develop protocols, please see Wall Residence's protocol training module for providers. Wall Residence's nutrition policy indicates that providers need a written food plan that ensures access to well-balanced, nutritionally sound meals that consider an individual's cultural background and food habits. Providers need to monitor an individual's food consumption for warning signs of physical or mental changes related to nutrition. A provider will need to provide assistance feeding individuals who require assistance and document compliance with prescribed nutritional orders on a consistent basis. Documentation requirements. Providers need to ensure adequate documentation of compliance with prescribed nutritional orders and recommendations. This is especially important for services where individuals are prescribed or recommended modified diets. The nutrition log is a good tool to capture documentation with prescribed diets consistently. The nutrition log can be modified according to the recommendations of a licensed healthcare professional. Your program manager can assist you in creating this document to ensure completeness and accuracy. Also, should you have additional questions or need more support, feel free to contact me. This is Wall Residence's nutrition log. The nutrition log is only required for services where an individual is ordered a modified diet for health and safety reasons. In this particular example, the individual has been prescribed a mechanical soft diet with honey-thickened liquids. You'll note that there's a place to document compliance with prescribed diets for breakfast, lunch, dinner, and snacks, and there's also a spot to write additional observations that are observed. If you should have any questions about this nutrition training or modified diets, feel free to contact your program manager, regional coordinator, or myself. My contact information is on the screen in front of you. Thank you. You have just completed Wall Residence's Modified Diet and Nutritional Support training.